Another question that I'm often asked by parents is, how do I get my child to interact with others? That is a huge part of what speech language pathologists cover with children with autism. We are the communication experts, and everything social is a communication. Your body language, how you're saying things, your tone of voice, and those are all things that are really, really difficult for our kids with autism to perceive and to replicate. And so speech language pathologists will often be the go-to people for social communication skills. In fact, there are amazing speech therapists out there that have written a lot of different social programs. Michelle Winner Garcia is one of the best ones. She's amazing. She came up with a program called Social Thinking. I would definitely look up her information if you have a child that is having a hard time with social communication. So what exactly is social communication? Social communication can include so many different things. First, it probably, as they're very, very young, it starts out with play. What does their play look like? So people, I hope you've heard this before, but play is the work of the child. And so if a child has a difficult time playing, they're not going to be able to develop the certain skills that they need to be able to interact with people as they get older. So social communication, so let's start with play. So speech therapists also target play therapy. There's a lot of cool research out there right now about what play therapy looks like. So play therapy, let's start. So you start and you have, the first step is just exploratory play. So I had a professor that called shake it, bang it, put it in your mouth. That's exploratory play, right? Babies do that. They want to explore it. They want to figure out what it is. The first things they do is their hands, then their tongue. They're exploring what that is. That's play for them, right? And then as they get older, we get rattles. They start banging things, right? They're over there smacking your counter, right? Because it just makes a fun noise. This is play for them. They're learning how the world works. So then we move on to relational play. They start putting things together. And then as they continue to regress in relational play, they then start taking things apart. So they put it together, they take it apart, they line it up, they stack it, right? We love to give blocks to babies. This is often the first point that we see children with autism have a difficult time. They love to do relational play. It makes sense. You can just stack it, you can put it together, this is great, this is where we stop, right? So the next step in play is we do functional play. So functional play is where, oh, okay, I had this block and I really like to stack it. Now I'm going to use it as something else, right? Now let's start to use this as a drumstick, right? Let's pretend a little bit with this, right? So this is where pretend starts to come in. So we tend to see our kids with autism kind of start to have a hard time with that pretending part, that functional play, right? So functional play is often where I start my therapy. My kids with autism, they love to stack things, so we move on from that.